PHI works to transform elder care and disability services by promoting quality direct care jobs as the foundation for quality care. We base our approach on decades of collaboration with Cooperative Home Care Associates, or CHCA. CHCA launched in the Bronx in 1985 as a worker-owned company with just 12 home health aides who believed, counter to the industry paradigm, that a home care agency could provide unemployed women with meaningful, stable jobs. CHCA founded PHI in 1991 to improve direct care jobs on a national scale. CHCA now employs more than 2,000 aides, and PHI has emerged as the country's leading authority on the direct care workforce. PHI's goal is to elevate the quality of direct care jobs across the long-term care spectrum, bringing stability to home care work and establishing it as a means to help women and their families achieve economic independence. A key challenge of the down economy has been its impact on direct care workers and their low-income clients. At the same time, significant federal, state, and local reforms are changing the way that healthcare is delivered. We are leveraging our expertise to support high-road employers in responding to these changes in ways that strengthen outcomes for workers and consumers. PHI's high-investment, high-return approach to home care is anchored in New York City. Our training program in the Bronx enrolls hundreds of individuals each year. We provide free, intensive training to help participants succeed in home care, and graduates are guaranteed quality jobs. We offer above-average compensation, full-time hours, overtime pay based on hourly wage, as well as competitive benefits, peer mentoring, worker ownership, financial literacy education, and career advancement. These practices drive employment and retention outcomes that consistently lead the field, and help us build the expertise that PHI provides to employers and policymakers in the Bronx and across the country. With offices in New York, Washington, D.C., and the Midwest, PHI is the country's primary source for direct care workforce information. We work with providers, consumer and labor groups, and public policymakers. Our policy expertise informs and is informed by our practice efforts. For employers and training programs, PHI authors curricula, designs adult learner-centered training, and trains other educators. With more than 20 years' experience, PHI has articulated a build ladders and raise the floor framework, pursuing systemic interventions that not only help workers climb out of poor quality jobs and into better positions, but also help low-wage workers to strengthen their current jobs to achieve basic economic stability. Our workforce program at CHCA has offered more than 7,500 job seekers opportunities for quality employment. More than 80% of trainees are placed into high-quality home care jobs, and our retention outcomes lead the field. PHI's New York City advocacy successes include influencing a 25% increase in base home care wages and helping to shape the state's transition to manage long-term care. From this New York City-based work, PHI strengthens the quality of jobs held by more than 100,000 direct care workers per year and improves care for more than 200,000 elders and people with disabilities. At a time when the majority of jobs added to our economy are in low-paying occupations, PHI is working to raise the floor to make poor-quality jobs better. While we work to establish career pathways in home care, we recognize that there are far more low-income workers than there are accessible, high-paying, good jobs for them to fill. So rather than only building ladders for the few, we seek to raise the floor to improve jobs for the many. These steps will ensure that we have the home care workforce that we need for the future. Over several years, PHI worked closely with our allies, providing research and advocacy to narrow the companionship exemption of the Fair Labor Standards Act, which for 4 decades exempted home care workers from federal minimum wage and overtime protections. In December of 2011, the U.S. Department of Labor formally proposed to rectify this injustice, while citing PHI's research more than 40 times. In September 2013, the Department of Labor ruled to extend coverage of the Fair Labor Standards Act to home care workers, a historic victory for the field. With diminishing public dollars and a range of policy changes pressuring the U.S. healthcare system, Many lawmakers and employers are unwilling to invest in the direct care workforce. But this resistance is perilous at a time when demand for in-home care is on the rise. Perpetuating poor quality jobs in this industry will mean greater recruiting challenges, higher turnover, and significant costs to public health in the years ahead. PHI promotes a high investment, high return approach. In a challenging environment, our efforts drive vital recognition that direct care workers are essential to our nation's economic development and to the independence and quality of life of its most vulnerable citizens. PHI is closely monitoring the shift to manage long-term care in states across the country. This shift will require new care coordination models and will provide unprecedented opportunities to promote best practices in home and community-based care. Our affiliate Independence Care System, a managed care organization serving several thousand consumers in New York City, helps PHI to strengthen its expertise within a changing paradigm of care. As more states embrace this managed care model, we look to apply lessons learned in New York to PHI's work nationwide. The wage floor for home care work established under the changes to the Fair Labor Standards Act is still insufficient. PHI seeks to launch a campaign encouraging states to set hourly wages for home care workers who are employed in public programs at no less than 2/3 of the state's median rate. Additional investment will also allow PHI to create an online resource center to help states develop robust direct care training standards. We hope to pilot and evaluate advanced aid roles, providing an expanded range of caregiving in multiple states. Finally, we seek a deepening of PHI's public relations, targeting new media to increase national awareness of the importance of the direct care workforce.